Hi, everyone. Thanks again for coming to another Ethics Committee meeting. I've been brought a couple more cases, and I think that we should just begin by going through and introducing ourselves again. I'm Angela.
I'm Denise.
I'm Jamie.
I'm Kirsten.
I'm Tammy.
All right, and thank you all again for coming. The first case concerns Kurt, who is a 9-year-old boy with Down syndrome and congenital obstruction of his urinary tract. He has been on dialysis 3 times a week for about 3 years now, and the question that was brought to us and that I would like to discuss with you is if it is ethically appropriate to consider this child with moderate developmental delay for renal transplantation. So does someone want to go into a little more detail on the medical facts of this case?
Well, he's had regular childhood diseases with a tonsillectomy and ear infections and that kind of stuff. And his one concern is that his IV access has become a challenge. And so without good ongoing IV access, it's going to at some point in time be difficult to do dialysis for him. So they are really in a logical place of questioning whether or not there's another option for him. And because he's otherwise does well, it's a real logical time to bring this up to see if he would be able to go onto a transplant list.
Great. Is there any other medical facts that anyone wants to add before we move into patient and physician preferences?
I don't know if this is where we would mention it. One of my challenges with the 4-box method is what goes in each box.
Mm-hmm.
Yeah.
But I think the fact that this, child who's developmentally delayed has been on dialysis 3 times a week for 2 to 3 years just shows that he can tolerate complex medical interventions, because transplant is significant. And I was just impressed with him or his parents or however they're making that work.
That's true.
Yeah.
And on top of that, they live an hour away from a medical center, so I can't assume there's a dialysis center down the road. So all that to say, I think it speaks to the fact that the family and the patient can handle medical complexity. Sorry. He's a therapy dog. He's helping all of us calm the ethics consult meeting.
Okay, I just want to jump back into patient and physician preferences. I know Dr. Stewart is his nephrologist, and that he expects that transplantation would significantly improve Kurt's quality of life. And then just in terms of benefits and burdens, Denise, I think you did a good job kind of bringing in like the burden on the family, how difficult this current course of treatment is. Does someone maybe want to explore benefits and burdens of continuing dialysis versus the transplantation, or any associated thoughts with that?
Yeah, it also says that here that Kurt might die if he continues dialysis because he's just not going to be able, his IV access is going to be so limited. But the fact that his doctor is interested in it and his dad is interested in it, that seems like that's really powerful.
I was unclear about who's questioning this, who's disagreeing, why, so I think, that they're in agreement says a lot. And I won't state my opinion yet, but.
I think that their concern, it says here, is because he is moderately developmentally delayed. But that's why he shouldn't have the same treatment as anybody else. I don't know.
I think that there with Down syndrome, there can be higher incidences of infection and autoimmune diseases, and that might be potential burden. So, maybe that's something to consider.
And then does someone just want to run through really quick some of the other contextual features associated with his case? I know that we mentioned that he lives about an hour from the medical center. Anyone have any notes on maybe other family members or
I don't know if we mentioned already that he does have 2 healthy siblings. He is able to walk. He's nonverbal. He does attend school at a handicap school. And he seems to have good and they describe him as smiling and eager to interact, can say a few words.
Yeah, I think that maybe the ethical concern comes from this being a case of allocating scarce medical resources in terms of transplantation. But I think we're all leaning towards the same idea that he should be treated as other kids are. But does anyone want to summarize their thoughts on recommendations?
It sounds like he's gotten to a place of need in terms of physical need. So based on that, he really does deserve a spot to at least get his place in line, to see if a kidney might become available for him.
I agree. Anyone else have any thoughts on this?
I also think that a kidney transplant, it's maybe not as much of a scarcity issue as maybe a heart.
Mm-hmm.
That's something to consider too. We don't have to weigh that consideration in this case.
Mm-hmm.
I agree. So in terms of recommendations, I feel like we're all on the same page, but does someone want to give just a quick summary about the recommendation we would make in terms to the ethical question?
I mean, I think at the very least he deserves an evaluation to see if he is an appropriate candidate to be listed. And to echo everyone else, or I think it was maybe Tammy that said it last, I mean, he's at a point of need. I mean, if he loses access and dialysis is even an option anymore, then it's death. And so at the very least, you know, an evaluation is warranted, if not outright placement.
Mm-hmm.
Great. I think in terms of this case, we're all on the same page, but does anyone have anything to add before we move on? Great. I think that was pretty straightforward, and I will take our recommendations back to the medical staff and the family. And then there's one last case that I want to discuss with you guys today. This is about Lei Lee, a 5-year-old girl who was previously healthy, but she has been admitted with progressive shortness of breath. And after an examination, it was determined that she has serious viral infection of her heart muscle and that her best chance of survival is getting a heart transplant. Her parents have declined the surgery, so her nurses have actually requested this ethics consult as they have grown pretty close to the patient. And today I just want to discuss with you all if it is ethically permissible to allow this child's parents to decline a potentially life-saving heart transplant. So again, I think we should start by reviewing the medical facts. Does someone want to give us a quick summary? I think there was a few statistics about her chances of survival, or maybe with or without the transplant. Does anyone have those?
Yeah, they told that she had a 90% chance of dying without the transplant, but with the transplant, she had an 80% chance of 1-year survival and a 75% chance of 5-year survival. But the parents have decided they wanted to take her home, and most of the stuff about this child is contextual features. So
Yeah.
I'll stop there.
Yeah, I think that's a good point. We could start with the contextual features if someone wants to jump in on those.
Sure. Well, her family is Hmong from Laos, and they have some thoughts on if she were to die in the hospital. There's belief that the spirit occupies the place of death. So if she were to die at home, then they could take care of the spirit at home. So that's one of their concerns, that she would not survive surgery.
I find it compelling that heart transplants really are scarce medical resources and not everybody can have one. And if a family has a really compelling reason why they're choosing to seriously consider declining the surgery, um, it seems like that would at least allow them to go down a path that they chose and that they can make sense of. And it seems to me cruel to force a family into a spot where they are now is in some sort of a heart transplant waiting game
Mhm.
only to not get one. It feels to me like it could be really disruptive to their family and really alter the way that they have to live with their child when her life is going to be so short anyway. If there were lots and lots and lots of available hearts and it was right there and they were just refusing an easily accessible course of treatment, I think that I would look at it differently. But heart transplant is not an easy go. It's very difficult. I personally know 2 different families that chose palliative care for children in heart situations, and it was difficult. But the way that one family said is that they said suffering was certain and survival was uncertain. And so that's what they chose for them. So I find that a compelling part of the argument.
I also wonder what, oh, sorry,
No, go
go
ahead.
ahead.
No.
What efforts have been made to bridge kind of the cultural gaps and maybe the communication. If anyone's read The Spirit Catches You and You Fall Down, that deals with a Hmong family, and there are things like looking patients in the eye that's considered disrespectful in Hmong communities. There's kind of a patriarchal culture where it's preferable to speak with a male head of the household before speaking with anybody else. And that might be something to consider, maybe that there are some practices that they're used to that aren't being considered. And maybe they just don't want to be in that kind of environment that is clashing with their culture so much. So maybe having someone who's very familiar with the and kind of can explain what ways will be successful for this family to understand their situation. I think that would go a long way in helping the family to feel more comfortable and maybe also get a better sense of their reasons for not wanting to move forward with the surgery.
And to piggyback off of sort of exploring the cultural stuff some more, so it seems what their objection to the surgery is the chance of her dying. So I don't know if there's any way in the hospital versus dying at home. So I don't know if there's any way the surgeons can speak to what the perioperative mortality risk is. It doesn't appear to be necessarily that high if they say she has an 80% chance of a 1-year survival. And I don't know what the risk just around that operative period is. So I don't know with a family like this if starting to do numbers would be helpful. It may or may not. And I'm curious, so if where someone dies is important, then how do they manage the rest of life? You leave the house, you could get into a car accident. You could, any number of things can happen where you die outside of your home.
Mm-hmm.
And so it's not necessarily to challenge in the sense of saying, this is wrong, but just really, lots of us walk around with beliefs. So I'm a physician, so and I do this with patients all the time. Like I tell patients, like, we all come in with these stories, and sometimes we need to look at what we're telling ourselves in our health story or in our narrative, and to just sort of probe that a little bit. And then, yes, I would really be interested in involving someone, if it's possible, and parents' consent, from the Hmong community. I don't know if there's an elder or somebody that can just really sort of speak to this and even affirm it. And yeah, we sort of need to probe this a little bit.
We want to make sure that they have a really well-informed, that they're that their whole that their decision is well informed. And sounds like we need a culture broker, not just an interpreter. Somebody who really truly understands both cultures. So I don't think we'd be ever wasting any time to make sure this family had a really thorough understanding on what we're speaking of. I'm also really curious about if they live very far from the hospital. If they live really far away, then they might maybe that child would have to stay in the hospital waiting for a heart transplant to happen or something like that. So I think that that's a contextual feature that would probably be important for them. What would it look like if she went on a transplant list? Does that make sense?
Mm-hmm.
And also kind of what you guys were saying with the understanding the culture too, that, this is something that we're not familiar with. And so we don't know if there is a compromise in there, also something that they're comfortable with that would also allow her to be a candidate for a heart transplant. There could be room for compromise if we understood their culture a little bit better.
I think it's important that the nurses that brought this to us are kind of involved in the conversation too, because I think that gap in the knowledge of their culture is what kind of prompted them to bring that this ethical question to us. So I think the nurses were primarily concerned with if it is ethically permissible, if this is what the parents decide to decline this heart transplant. What are you guys' thoughts on, is it, bottom line, is it ethically permissible?
Yeah, I think they're making this decision out of love and what they believe to be the best interest. So I think it is ethically permissible.
I already said I lean towards believing that it's ethically permissible. The one piece of data that I would want to find out before I really would completely be 100% on board is the actual likelihood of them getting a heart. If getting a heart were genuinely likely and without being a significant, huge disruptive hardship for their family, I might lean a little bit more towards that side, but I'd have to get some really hard data on what the transplant system looked like in the city that was close by them to know how likely an actual transplant would be. But if it is unlikely and it would simply complicate their lives, then I think it'd be perfectly okay for them to go back home and take care of their child the best they knew how.
I think that's a really good point and an important distinction. Kirsten,
Whatever.
what are your thoughts?
Yeah, whatever.
I think it is ethically permissible to allow them to care for their child in the way that they think is best, and if it's something that helps them with it through their belief system, I think that is fine. But we want to make sure that we're looking into everything that we possibly can to make sure that they're making an informed choice.
Great. I think we're all, again, on the same page about the importance of communicating with the family and making sure that they have a thorough understanding before we make any final recommendation. But does anyone else have any final thoughts?
So I'm struggling with this a bit. So as I understand it, and as it says in the text, in Western culture, overriding parental refusal of potentially life-saving for a child is generally thought to be justifiable, even when the refusal is based on cultural or religious belief. So, for example, court-ordered Jehovah's Witness transfusion. So I'm failing to see the difference between that and this case. So I'm open to be told otherwise.
I think it's because it's a scarce resource that's the difference.
So I know that's what the text says. And so this may just be something of, sort of, that's what the practicality of it is versus, in my mind, foundationally, I don't see how you can.
No, I think you're asking a really good question, because there are times when we really do override parent, especially when it's a life and death thing. Like if it was chemotherapy, we'd be putting the kid on chemo and everybody knows it. So I think it's an excellent question. And I think that's where I will admit that I'm sitting on the fence because of not knowing the the true accessibility of a heart. If a heart was really truly available and it was right there and they could have it, I'd have a hard struggle if they just said no. If they just said, we're offering it to you right now, a donor's just, and it's right here. And they said no, I would struggle with that. So I guess I don't understand to what degree getting a heart is actually a reasonable expectation. But Denise, I think that your questions are valid, and it's really consistent with other pediatric ethic things. So yeah, that's a really good question.
Yeah, I think the practicality of like getting a heart is important, but I wonder, like you said, foundationally, if that is what makes you lean towards yes or no. So I guess I'm also a little bit on the fence about whether it's available, if it makes it ethically permissible or not.
Yeah, I don't understand that departure in terms of the thinking, the logic of thinking through it. I mean, in general, I tend to think if a parent wants to do something with their child, so this is my first class in this program, by the way. So,
you're good.
If that makes a difference with anything. So it's not like I've actually sat and thought through a lot of these things. But, even when I hear about the Jehovah's Witnesses and mandating blood transfusion for their children, that strikes me as wrong.
It's invasive. I mean, and we do it all the time.
Right, that's what I mean. And so, because I presume the Jehovah's Witness has a spiritual concern, I mean, I'm not familiar with the belief system, about why they don't want their child to get a blood transfusion. So again, I just fail to see where, because of the scarcity that we're now, or even Dr. Orr, said it was ethically permissible to allow this family to take the child home. But maybe there's no clear answer. So all that to say, I'm on the fence, but if I had to vote, I don't know. I'm going to abstain.
I think this really is one of those things where I don't have a thorough understanding in their culture. So maybe with like more discussion or getting someone else involved that has like a better idea of their culture, maybe I could be swayed one way or the other. But since I don't have a really good understanding of their culture right now, I think that's where I'm also on the fence.
If anyone gets the chance to read The Spirit Catches You and You Fall Down by Annie Feidemann, that deals with this exact issue, but the problem is when you finish the book, you'll be like, I don't know what the answer would be there. It really goes into the details of the tragedy of this one very young girl's interactions with healthcare institutions and her family and their beliefs and doctors' beliefs. And they had nurses and doctors who were so invested in this child, but there was just such a huge clash. Communication helped, cultural brokers helped, but even then there weren't solid answers on what could have helped her situation.
Well, I mean, even within my culture, we have these difficulties. You know what I mean? Like, yeah. I walk into a room and you look like me and you sound like me and we are culturally as similar as possible. Like, we still have, massive disconnect and disagreement, even within cultures, much less outside of it. But so yeah, it gets complex. But I'm just still struggling with how we compel the Jehovah's Witness or the child to get chemo and the Jehovah's Witness child to get blood transfusion, if we're saying sometimes we should do otherwise.
And then sometimes compelling involves coercion, and that gets into the autonomy question, and you have to be careful about.
And I think, to me, there's a little bit of issue with regard to certainty of success of the procedure. If a child is absolutely going to die, but you have a procedure that has like a 99% chance of saving their life, I can see like, yeah, the odds at that point in time are so strong that I could see a person making an argument that it's reasonable to compel somebody to do something. I have a much more difficult time once the odds start to go down and the chances of having the procedure procedure done in the first place.
Right.
To me, the fact that a heart transplant is perhaps not going to happen because a heart isn't going to be available. What kind of hardship are you going to cause for people for a treatment that's never even going to happen? That I find that very influencing in that situation, because if in fact her life is short, I think they have a right to live it the way they want to. But if it was a situation of a 100% guaranteed, which nothing in life is 100%, but a very certain medical treatment, I'd be talking about getting some sort of a court order for it, but not a heart transplant.
No, that's fair. That you're easing me along.
And yeah, I think that the reason why these things are important is that these kinds of cases are hard, and if it was really easy, it wouldn't be in the ethics committee. There are things that really make it difficult, and sometimes you end up coming up with a decision, and you'll never probably ever know for sure that it's right, because the case will only go one way or the other.
Mhm.
It's kind of tricky. What sort of medicine do you practice?
I'm emergency medicine.
Okay. So you see a little bit of everything. Okay. Wow.
Yeah, I think that this was a really good discussion, and we don't necessarily have to make a decision amongst us 5 right now about the fate of this 5-year-old girl. I think that through this discussion, we kind of learned different paths that we can take, and like different avenues to explore with the family and other people we can bring in, maybe to get a more thorough understanding, and then maybe further the discussion later down the line in a relatively timely manner.
Well said.
All right, does anyone have any closing remarks about this case?
I think we would ask more questions of the team and find out more specifics before I would make any absolute determinations of that. But yeah.
Good point. All right, any other closing remarks?
You're a good crowd of ladies to work with.
All right.